Divine Kaylas. Welcome to my channel for spirituality, recovery, talk, and guided messages. I'm here with Jamie and Kayla.
Hello.
Hello. How are you guys doing today?
Good.
Good.
Doing great today.
Okay. So today we're tackling trauma and addiction. I know me personally, I've been through a lot of trauma, starting at a very young age. And, I was born an addict before I even touched a drug. Like, I had that in me. So when traumatic events started to happen in my life, I coped with using alcohol and drugs. And I didn't know that I was an addict. I didn't understand the disease. And for me, once I started to understand the disease and other people, like, I really started to take on those healing, to heal. And like I've said this before, but I think it's important to remember to be patient with yourself when you're doing those things, because it's not going to change overnight. If you're watching this and you're struggling with any traumas, and you can reach out to any of us, I'll tag Jamie and Kayla in the video, and we're going to share today a little bit about, I told them they don't have to share about their trauma specifically, but how we're dealing with that today, the solution. Like, we want to live in the solution, right? So Jamie, if you want to just say a little bit about, your experience with trauma and what you do today to kind of combat that.
Okay. So for me, my, experience with trauma, didn't happen at a young age. I just did my autobiography and, for therapy, and in it, I stated, all the trauma that I've been through has been created through my addiction. Not like I made the trauma happen, but doing, being an addict, you put yourself in risky situations, and you put yourself around people that also use. So
yeah.
For me, I had a boyfriend, Sam. We were together for 4 years, and he and I went to treatment for the first time, and he overdosed and died on my first day outside of treatment in Halfway.
Oh my God.
And
I'm so sorry.
I'm going to be really honest about it. That was really hard, and I went on a run for 4 months, and I just set back the healing process for so long. Around the 5th month, I put myself in treatment again, and that's when life hit me, and I just cried for hours and hours and hours. That's probably the most traumatic thing I've been through, really. But now, I'm working on it, and this happened almost 7 years ago, and I still think about him every day.
Of course.
I've never really worked through it. I touched it, a little bit, or touched on it, in different treatment centers and stuff like that. But I'm journaling. Sometimes I write to him.
That's very therapeutic.
Yeah, it really is.
Mm-hmm.
Yeah. And just, other traumatic situations, being homeless, that was pretty traumatic. I've never been homeless in my entire life, and my addiction just got so bad. So, now I'm doing things different this time around in rehab, and I feel like that, is going to hopefully, make a difference. I'm doing the whole drop-down program. I usually just do residential and leave and go to Halfway, but I'm in PHP, and I start IOP tomorrow, and I'm really trying
Congrats.
to... Yes, thank you. I'm really just trying to, have acceptance,
Yeah. That's a big part of it, is having acceptance, know. Sometimes we don't have control over the things that happen. I mean, we never have control over the things that happen to us, but we do have control over how we react to those situations. And that's one of the biggest things I've had to learn over the last couple of years. So, Kayla, did you want to touch on it?
Yeah. There's a lot of traumatic things that can happen during your addiction. For me, there was multiple things. I dealt with having guns pulled to my face. I've had living in my car as well. That was very traumatic for me, because I couldn't go home. My family didn't want me to go home because I was using so much.
Yeah.
And also another traumatic thing is having little siblings and little cousins that look at you and they're yo, for example, when I was in treatment before I came to PHP, my grandma told me that she brought my little cousins to drop me off. And my little 9-year-old cousin was Grandma, how come Kayla is always getting like taken to like these places and having to go away, and why does she chill with all these bad people? And like for me, that was like an eye opener kind of in a way, because I was like, damn, like I'm supposed to be an example for these little kids, and
Yeah.
like I'm the only example that they have. Like they have like obviously adults, but like they're looking at us too, and they like look at what we do and all that stuff, and it's like, you know, like it's just crazy, like being in addiction and having to go through things. Like I used to like take drugs to numb my pain, and like my grandpa passed a couple months ago, and like I was, that's right, I was like already getting sober before I relapsed. I was getting sober and I was in a halfway house, and the first thing I wanted to do was go use, but I didn't, because I was like, you know, like we can get through this. Like there's no need to go back out and use just because you're hurting in some type of way.
Just prolongs it.
Like there's always a way to get around it. And like I look at it like we call them like norms, like people that normies. I say norms. People that don't use drugs, like, you know, I think about like what would they do in a situation like this? Like they would just deal with the pain, plus see a therapist or something. So like I look at that and I'm like, okay, let me do that instead of going back to this.
That's amazing.
We do have to be a good role model, you know, like for like we have children, and it's traumatic. I know for me and for you to just be away from them right now, as much as it is, it's very traumatic for them too, and that's hard. That's traumatic in itself, really, for us, because like we're both good moms, you know, we're good people.
Yeah, that's probably, Jamie, one of the hardest things for me personally is being away from my kids. But I have to be, again, patient with myself because I'm healing. And balancing your well-being is like, you know, especially after dealing with traumas, you're all out of whack. Like you don't know what's going on. So like balancing like your nutrition and exercise and your mental health, your spirituality, and having fun. Like having fun is a big part of it too. Like balancing those 5 domains are like really important for, you know, dealing with traumas and you know, your well-being as a person. So if you guys are dealing with any trauma and you're trying to work through that, just make sure you're coping, because going back to those places, sometimes you can relive those emotions, and just remember that feelings are not facts and that they will pass. And especially with like the loss of somebody or being away from loved ones, just, you know, try to stay strong. Like, you know, we're all going through this together. So thank you guys for sharing. I really appreciate your time. And do you guys need anything? DM me, put it in the comments. Like, what are you guys struggling with? Like, what are you working on right now as far as your healing process and addiction and recovery? Okay, thank you.